Hello, this is Dr. Jason Hecht, and today we're going to be talking about the single missing tooth. When you're missing a single tooth, you really have two options to replace that tooth permanently. One is with a 3-unit bridge, which is the traditional method, and the other is with a dental implant. And let's look at the differences. So here we have a single missing tooth, and we're looking at bridge versus implant. Here's the traditional method where we actually make mini versions of these teeth, and we put a bridge that replaces this missing tooth. And here's the newer method, the single dental implant, where the two other teeth are not touched at all. And this preserves these teeth to be totally healthy. So here we have a comparison between the implant and the 3-unit bridge for a single missing tooth. So a lot of patients ask, how much does an implant cost more? Well, actually, in comparison, for one tooth missing, a single implant versus a 3-unit bridge, the implant is less, because if you imagine on the bridge, we're working on 3 teeth, but the implant we're working on 1. The one disadvantage of an implant is time in some cases. An implant can take no time, like tooth in an hour, which you've heard of, up to about a year, 8 months to a year, but a bridge is typically completed in 2 to 3 weeks. Is it damaging to healthy teeth nearby? In a single implant, we're only working on that one missing tooth, so we're not touching the 2 teeth on either side, so it's not damaging. But with a bridge, if you have 2 healthy teeth on either side, it can be damaging because we do have to cut down those teeth to make the 3-unit bridge. Longevity. There are dental implants from the 1960s that are still in people's mouths, so we just put this number up here, 30 years, because it really is a lifetime solution. Whereas a bridge, because you have 3 teeth and there's some rocking going on, the typical lifespan for a bridge is about 5 to 15 years. Is there an effect on the other teeth? With an implant, you're preserving the other teeth, and you're actually preserving the bone in that area. If you do have a 3-unit bridge, you might notice if you go up and feel the area where that missing tooth is, you're losing bone over time. Whereas with an implant, you're maintaining that bone because that tooth right there is chewing and it's functioning and that bone is being used. Is there risk of decay and more tooth loss? With an implant, no, because those 2 teeth are not touched on either side, and you're able to get the floss in between very nicely. But with a bridge, there is that risk of decay and more tooth loss. Around the margins of the bridge, you can get food caught, and you can have rocking of the bridge, which can lead to decay and tooth loss. And this has been your Dental Health Minute with Dr. Jason Hecht. Thank you. See you again.